Right now, it's the era of immunotherapy and targeted therapy. So we are sequencing everyone's tumors. We are trying to get drugs that target those mutations and use the immune system to fight the cancer. And that's the journey of personalized medicine. It's something you have to do as part of being a doctor in almost every field now is about personalized medicine.
Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kim Douglas. On today's episode, we're going to talk about personalized medicine. And if you're like me, I'm looking forward to finding out exactly what personalized medicine is and why it's a game changer when it comes to treating different illnesses. Our guest today doesn't treat every patient the same conventional way. He steps outside of the box when it comes to treatment. Dr. Santosh Kesari is the Director of Neuro-Oncology at St. John's. Welcome, Dr. Kesari.
Pleasure to be here.
I'm so glad you're here. So let's start from the top. What is personalized medicine and why is it trending now?
Personalized medicine is really the concept of taking all the factors of any individual into account for their diagnosis and for discussing treatment options. And it really, in the last 20 years, has really evolved. And in the last 5 to 10 years, really evolved rapidly. And especially in cancer and also now heart disease, but every disease is rapidly evolving, the field of personalized medicine. In the beginning, it was all about genetics. What are the genetic predispositions to diseases? How does pharmacogenetics affect your response to drugs, whether it's a positive response on the disease or a side effect of a drug? How do your genetics determine that? But now, as I mentioned, in the last 5 years, it's evolved even further into all kinds of other personalized information about you and how that can affect a doctor prescribing medications or treatment recommendations.
So you said 20 years and 5 years, but when was the actual moment that you knew it was going to be the future of healthcare?
I think we all knew even during medical school, 30 years ago, we talked about how mutations in genes causes diseases, whether it's cancer or risk for Alzheimer's or heart disease. And now that field has grown so rapidly that we know what those mutations mean, how they affect risk. And then I think in the last 10, 15 years, it's really development of therapeutic interventions for those genetic subtypes that has really, I think, made it clear that you need to understand what are the genetics and because it affects your response to treatments.
For sure. So what are some of the factors that you consider when you're creating a personalized plan for your patient?
I think, outside of the genetics, obviously patients' age, how far they live from the hospital, clinically we know whether patients will tolerate some things or not, just based on our own experience. And patients also have preferences, right? Some patients are interested or not interested in certain approaches, especially in oncology. We have a lot of patients, for whatever reason, in Southern California that may not want to do chemotherapy and radiation or worried about it. So even those personal preferences we have to take into account when we're personalizing treatments for any one individual.
That makes so much sense. So talk about how personalized medicine also includes lifestyle adjustments, which you kind of touched on right now.
Yeah, I think it's very clear that we have to take everything into account. As I mentioned, the patient factors, right? Their preferences, the age, sex, everything. And then what are we dealing with here? What is the topic? Is it cancer? Is it heart disease? And then there's a whole bunch of variables within that. I'll give you the example of cancer because I do that quite a bit. And, lung cancer used to be 2 diseases 30 years ago, large cell or small cell lung cancer. Then about 20 years ago, we started sequencing everyone's tumor more frequently at the basic science level and finding all these mutations in all kinds of cancers. And these mutations are the cause of the cancer in many instances. That's great if you identify what the cause of the cancer is, but it's really in the last 20 years where we've developed drugs to target those mutations that has changed the game completely, and that makes personalization a necessity. It's not something that's an option. We need to understand what is driving the cancer based on these mutations, and then those mutations dictate now what the treatment should be. So not all lung cancer, for instance, is treated the same anymore. We need to know what the mutations are, and then that really from the beginning of the diagnosis dictates everything else that happens to the patient, the prognosis as well as the treatment options.
That's huge. That really is. So when should someone request a personalized medicine plan? And do I need to leave the interview right now and get on the phone with my general practitioner?
Well, I think many doctors have embraced this approach,
Right.
And from general medicine, mostly dealing with cardiovascular or pharmacogenomics of response or treatment of drugs or potential side effects of drugs, even antidepressants. Some people order testing to know whether you are going to get a side effect with one class of antidepressants versus another class, and that can help reduce the chance of having a negative effect if you follow a guideline or a protocol in your practice of if you're depressed, you start with drug A, then drug B, you may change your mind knowing that this particular patient in front of you may have a side effect with drug A, and you may immediately move to drug B. So I think that's how it helps at the general GP level. But like I said, in the specialty level of oncology or dementia or heart disease, the genetic testing, and it's more than just genetic testing. We're also doing a variety of blood protein testing, and even imaging can be personalized. Imaging can tell us information about personalized treatments as well. So all these new technologies really enable us to basically subtype the disease, subtype the problem. Instead of calling it dementia, it's Alzheimer's dementia or cardiovascular dementia. So that helps us really decide on the best treatments after that and how to monitor the patients.
So that was going to be my next question about how technology has helped to personalize medicine. And you've kind of explained that, right? It's been very important.
Yeah, from the imaging side of things, as well as from blood tests, new approaches, to even at the tissue level when we do a biopsy. 10, 15 years ago, we would just have a pathologist look at the tissue and call it based on a bunch of markers. Now, routinely, we're sending it for sequencing. And it used to be 10 genes 10 years ago or 100 genes 5 years ago. Now we're doing sequencing of all 22,000 genes. And it's a lot of information, a lot of data, and we need bioinformatics people to help us analyze that data. But there's a rich amount of information there that helps us really from anywhere from picking a drug, a targeted drug, to chemotherapies as well, to personalized vaccines. We're doing that for some patients as well. So we're in the real thick of it in terms of the genetic era of molecular medicine and using the information about the genes to plan treatments for patients. And it's because we also developed new drugs.
Right.
And new immunotherapies, new vaccines that target those mutations. So it's really just the beginning of a real explosion of personalized medicine. And that's in oncology, but I think all the other fields, we're seeing inklings of personalized approaches for everything, really, from infectious diseases to cardiovascular diseases to stroke management and certainly to dementia.
You're so right. Let's run through a few of the illnesses that really would benefit from personalized medicine and how they would be treated. So we talked about cancer.
Yeah, so cancer, it's really about the genes. What are the mutations? And these are the mutations that drive the cancer. And now we have several hundred drugs on the market that are approved for different cancers. And for instance, with brain tumors, we have very few options. But when we find a mutation that we know that mutation predicts a response in breast cancer, or lung cancer, or melanoma, we can use these other drugs that were developed for other cancers when we find that the same mutation is present in a brain tumor, for instance. as I mentioned, we sequence every patient's tumor, so we know what all the mutations are. And in about 1 to 5% of patients, we find these very rare mutations, such as BRAF or HER2 or PI3 kinase that are present in, for instance, melanoma or breast cancer. And so I have, for instance, a 16-year-old who was put on hospice. We found a breast cancer mutation in her tumor. And so we got a breast cancer drug called everolimus for her, and the tumor shrank 90% within a few months, still alive 6 years later. So that is what repurposing drugs means. That is what personalized treatments mean, where we find these mutations that are rare in brain tumors, but we know that these mutations predict response to a drug maybe for skin cancer, breast cancer, lung cancer. And we use it in the brain tumor context, and we can see in many cases amazing response when we pick the right drug for the right patient.
Absolutely. So beneficial for the patient. Dementia or Alzheimer's?
So dementia also can be personalized because dementia comes in many different flavors as well. There's Alzheimer's dementia. There is dementia with Lewy body disease. There's dementia due to cardiovascular disease or stroke. And there are even rare dementias. So it's a big pot. When we say dementia, it's a big bucket of various causes of dementia. And that's important too, because now I'm sure you've heard in the news about these new antibody drugs for dementia that are getting approved and that are getting available. And that really is a personalized treatment as well, because it's for Alzheimer's dementia with a particular imaging test will show that you have the plaques that will respond to this antibody. So I think, and obviously a stroke-related dementia or diabetes-related dementia is going to be treated differently than an Alzheimer's dementia. So even in that field, even though we don't have as many drugs, we are thinking about how to personalize treatments already. One of the biggest things actually that connects cancer, Alzheimer's, and other diseases is the immune system. And we're just beginning to understand the importance of the immune system in many, many diseases, from heart to the brain to cancer. So, and that's something in the last 5-10 years is becoming more and more clear.
Yeah.
Especially in the cancer field, but I think we're gonna learn a lot more about how dementia may be an immune problem as well.
That's very interesting. We need to have you back and talk just about that. What about multiple sclerosis?
Multiple sclerosis is clearly a immunological disease, right? It's an autoimmune disorder where the immune system, for whatever reason, recognizes the brain as foreign and attacks it. And so the treatments that we use are immunosuppressive treatments, drugs that will suppress the immune system. And so that also is, there's different types of multiple sclerosis. So we have to understand that, and there are different drugs for each person. And so we also are doing quite a bit of personalized medicine in the autoimmune disorders field, which is what multiple sclerosis is one of the big brain diseases that we deal with.
COVID-19.
COVID-19, obviously vaccines are personalized, but not for the individual, but personalized for the virus, meaning that the initial vaccine was what was available initially was made for the variants that existed then. And then the boosters changed over time because the virus evolved.
Right.
And so then that's why we still need to do boosters, because the virus keeps changing and we need to personalize the vaccines each time the virus changes. And much like it's going to be like the flu, right? It's essentially that's where we're at right now, where the flu we get every year is made from the flu that we identified that is floating around in Europe. And the vaccines that are made in the US for flu are based on those personalized variants that are found and given every year to us. And that's what's going to happen with the COVID vaccine as well.
Any other diseases worth noting that I didn't mention?
Every disease is really personalized.
Yeah.
The treatments, like infections outside of COVID, we personalize the antibiotics based on the sensitivity that's probably the first era of personalized medicine over 100 years ago is really in infectious diseases, because we paired the bacteria to the right drug that the bacteria was sensitive to. In many ways, we're doing the same thing in cancer and cardiovascular disease now, more specifically than we've done in the past. So I think it's going to be continuous evolution. I mean, that's a wonderful thing about medicine is things are rapidly changing, and that's what I love about it as a research scientist as well. Probably the biggest in terms of cancer revolution that's happening, besides immunotherapy and using the immune system to kill cancer, is really early detection of cancer. And now there are these new technologies where with a simple blood test, you can detect 20, 30 cancers at once. So that's really changing the game in terms of early detection.
Let's talk about the future. And what I love is your approach. When it comes to medicine, you believe that we should be more focused on being proactive and taking preventative measures. So what does that look like?
So it's clear that heart disease, dementia, and cancer did not occur the day you were diagnosed.
Right.
It was a process that's been happening in your body for many decades.
Many decades.
Decades, potentially. So in order to reduce the healthcare costs that are continuing to rapidly escalate, we have to do better prevention. And as part of prevention is early detection. We have to have a guideline individually for us to know how we're doing and gauge ourselves to other people and have metrics that we can monitor, much like, we do fitness metrics, right? We do height, weight, vital signs. We need other vital signs that tell us about risk of cancer, risk of heart disease years later, risk of dementia years later. And a lot of it revolves around nutrition, exercise, mental health. Stress causes immune dysfunction. All of those things, diet, exercise, nutrition, psychological stress, etc., I think are all causing metabolic and also immune dysfunction. And so the better we understand what we eat, how much we're walking around, how much social interactions we're doing, how can we quantify that? How can we put it on our app so we can track? That's going to help us decide on how to prevent things decades later. Because we all like to eat and drink and not exercise.
Yeah, and isolate. There's been a lot of isolation.
So but we don't really know how to track it very well. And I think with the smartphones, there are apps doing various versions of this, and we need to do more of that to help us understand. Now, the early detection test that I mentioned is also helpful. Instead of the simple way of doing an annual physical and some simple blood tests, there will be more refined and extensive genetic and other testing that's going to help us understand, even at a deeper level, what's really happening to our immune system, metabolism, and these more sensitive markers that could help us predict things years later.
Such important information, truly. And we really can do those things for ourselves.
Absolutely.
So given our current model of healthcare and research, what challenges do we face when it comes to being a more proactive healthcare society?
So I think we need to engage patients, individuals, in order to do preventative medicine. And there's a lot of psychological, social aspects to that, and family and friends and connections. So I think in order to do that better, we need to engage technology and healthy habits and learning about what we're eating and exercise and reminding us, because we all get busy in this very stressful and busy lives that everyone has. And but I think when you empower a patient with information and make it easy for them to track what they're doing, I think you can modify behaviors. And I think that's going to be the biggest thing for the future, is really about prevention, which is modifying behaviors.
Exactly. Now let's move on to drug development. So drug development is a key component to personalized medicine. Can you talk about the process of getting a drug developed?
So once you have a disease, you have a diagnosis. That's when we talk about drugs and treatments.
Right.
So the drug development takes approximately 20 years to make a new drug. So it's a long process. And obviously, we have thousands of drugs now. There is also a faster way called repurposing of old drugs. And we do that in cancer quite a bit, as I mentioned earlier about if you have this melanoma drug that treats a specific mutation, you find it in brain cancer, then we can simply switch it and use it in the brain cancer setting very easily, quickly. And that's the off-label treatments. But many other things, when it's from scratch, finding a new mutation and discovering a new drug does take at least a decade or so. So basically, it starts with chemistry, understanding what that mutation does, what that protein does, doing a lot of laboratory-based research, and then eventually you're convinced that this is real, that this drug is helping the cells in a dish, and then you translate that into the humans by doing phase 1, then 2 and 3 clinical trials. So that's why it takes quite a long time to develop a new drug.
So, doctor, what makes personalized medicine so special at St. John's?
St. John's is a very special place. I've been there 8 years now, and I appreciate it more every single day. And I think it's because of the caring, personalized environment there, actually. But in the context of both cancer and neuroscience, I think that the great thing about it is we have a multidisciplinary team, from surgeons, from radiation oncologists. In the cancer center, we have a team that looks at each patient from a different perspective and comes up with a very personalized treatment for each patient. I think that's multidisciplinary care at its best. Besides the personalization based on the cancer itself in terms of treatments, we're personalizing all the multidisciplinary care as well. And I think that's really unique and collaborative. And these are doctors that I trust and that are really amazing at what they do. And so that's really, I think, what St. John's is all about, personalizing treatments in a multidisciplinary fashion for each and every patient that walks through the door.
I agree with you. Well, let's talk about you now. How did you get involved with personalized medicine, and did you always want to be a doctor?
Yes. My father was a family practitioner in rural West Virginia. And so I was influenced by him when I was growing up. And I was already very science-minded, mathematics-focused, and I wanted to make a difference and help patients. So I think that exposure made me realize early on that I wanted to be a doctor and a scientist. And then, I'm a neurologist. I love the brain, thinking about the brain. And I decided when I was during neurology residency that brain tumors were a very dire situation. Patients died within a year, not much treatment options, and so I gravitated towards really bad things. And as part of my PhD, I worked on brain tumors and using viruses, oncolytic viruses, to kill brain tumors. That was 25 years ago. Now we're doing clinical trials using those viruses. So in terms of drug development, it took 20 years to get from that concept in the lab to patients. So as a neurologist and an oncologist, I really want to figure out brain cancer. What causes it? What can we do? What can we harness? Right now, it's the era of immunotherapy and targeted therapy. So we are sequencing everyone's tumors. We are trying to get drugs that target those mutations and use the immune system to fight the cancer. And that's the journey of personalized medicine. It's something you have to do as part of being a doctor in almost every field now is about personalized medicine. And I think on the neurology side, as a neurologist, when you have brain cancer, you get the same symptoms as a dementia patient or a Parkinson's patient. We deal with all the same issues because when a tumor is pressing on your brain, you get stroke-like symptoms, you get memory problems, you get seizures. So we have to be pretty open to all the neurological things that happen in our cancer patients. But the interesting thing is what I've appreciated, because cancer now is an immunological problem in the last 10 years, right? So we're realizing that even the dementia and everything, there's an immune problem there too. And the drugs that we're using, including the immunotherapy, sometimes cause side effects that are like a dementia because the immune system is overactive. So I think it's been it's coming full circle from learning in medical school about how the immune system works, and now in actual patients, we're using immune modulatory therapies, either stimulating the immune system to kill cancer, or in the case of multiple sclerosis, we're suppressing the immune system so that the inflammation is controlled. So it's really the interactions with cancer, immunology, and dementia and other diseases is very clear to me. And that's all the broader perspective of personalized medicine is. It involves all these different organs are contributing to almost every single disease. You have to understand those interconnections and how to use drugs that were developed in another setting to potentially help for a different disease.
Absolutely. So we have this little ending to our show where we like to ask you what a takeaway is for our audience. So is there just one thing that our viewers should take away, that you want them to take away from you in today's discussion? What would that be?
I think the most important takeaway is really that personalized medicine is here, and your treatments are going to be increasingly personalized for you based on your genetics and a lot of other variables, including age, sex, height, etc. But that is the future of medicine now. And that means that we can give a drug that's going to work for you with the least side effect, which means we're going to save a lot of money as a nation, as a population, because we will know how to use the resources that we have available more cost effectively.
It's good news for everybody, right? Well, that's about all the time we have for today. Thank you so much, Dr. Kesari. We're so fortunate to have an oncologist and a scientist like you teaching us all about this great information. It's been a pleasure.